kalyer belu alba belak malumi belak mal globo bay dorai bo me sabalwal mabli takol warar elangi oy magatagata Di musuh lekate tararo maoi magurga ebe ori re dagasoe di musuh lekate tararo Maral del Rey Calmaral di Meangla Elisel Belau Regi Debe ser sabalwal mabli takol wararaelangi awe magatata wanan di musudargu lekateta
Good evening, Palau-wide. Good evening, worldwide. Good evening to everybody. This is Alfonso Diaz. We're going to do this update tonight, which is we all know that it's scheduled for Thursday evening, but the urgency of this information has to go out to the people. So what we have here tonight is Commander Bostrom Commander Prostrom from CDC, and also our Commander Udui is also with us, and all the EOC members. Good evening, everybody, and welcome to this update from EOC. Madalwese solange kadmamu leriter, mang sakli di reklo aisilwase ngarel belawa obanged. I hope that obanged rabik chin sabik ngariat updates. Malungil ko sengel moraru ko other reklo audience ra. IP FM solai bots veden bot magat broadcast tel updates and moraro kuil other tira o kuknatun ini o reng sera update tra IOC elo ya kata WFM ma direkl Eco Paradise. Okay, badal wese sola marungil ko sengay yadung walan ngumsa Commander Udui mabolo mo ra programa gidral ko sengay Commander Udui.
Oh ya, tulang itulig yung ngil ko sengay.
Ko sengay.
Oy. So kato ko rati ko operay gele update rigidel om das war adal ako ramal di sorry mom dingya number ay gal case.
I say.
Maximo o ay say gele le update tra kasus and then edi may maskip say gidel wal kora. Ya kora dil ka kalbol final lo ur.
Okay.
Mang di kora tentative ura el alsil sa mamatir ka malaya yero kuil lo urmesel pol later el algabsengay ang sa amlo sabdi sayid el mal el hora updated el shasting el diesel ay gidele case so sayid ya kada dengel wasa eli ang malgoram lo obuto kagay sayid el lo 55
okay
ngaringiya 255 el test ra contact tracing el rule etiya dan longara 48 positive ni ngaringi tirgelem le outbound el duru le direkal 92 ya a fiber tiram lo positive mang el total el total case ra a eli no direkal naringan nila ER lo 55 kasi el lo oral 55 eli ngarinya kadam lo ulara rogo yung ni rogo yung total cases amlo 119 lengar nga igele active cases travel 92 ay igele koradim lakal sa amal giti talwase ay gang connected al morangaral travel case ay kira ko amle 8 etirigel mlamongil up to Eliam 19 matawal tilo para isolation. So sa kitang 119 na cumulative cases since rato ato hotel mostar sa lomesa geyser sira August 20 last year el mer el ang.
I see.
Tirigal abel nga quarantine up to LL still samle 394. LR other surveillance ra malamol mal el marula contact tracing mildang al mer eli. And then mosa amal update ra number sa maltelang al adal nga quarantine kada tingel wasesel dorula contact investigation etamo tomgodong ringel case wasay kawgam larigera o ingaral time truas ala kapos kama mang clear adal problem ke the students el momiter sayid el definition el dol gormil wasay tru may malbungol el kaybuge el ngara carrera 6 feet dalong lila ridel til up elang sayidra hakasusal leitra kasusal mer el altu tawe ay gel goram la saba malo doktal lo ureng ngaradoria okay so maselway sayideng walbol el 100 toria active hindi mla ka complete ra isolation routine malubak dong kodong artilo set the recover tamang biro ko sisiwa ha o urigit ngariya mo test raklugo ra o truel mina sen moment testir maltak lugo ng buk mo ngariya mla mo ngil the release testir min se el buk mo o telgibel ngarba pa o urigit
I say
oy so sige da tulig ngariya direkal sele kora PSA diri multabdil wasay ngomur el sils eng modia ka oting lara hospital kadokablo wasem lari sel 1 hour 6 to 7 dar adal mer hospital me mesra har adril meran di elangi because ngutu tayidal kora situation nagida sen kora batak nga guys en so adal kora protected tirakal sfera adal ngara hospital magpodya ka oding modya ka adal mesois pro hospital dia ka do tingel sa kadam tingel wasit sa tukar tirakal sfera asymptomatic or tirakal sfera covid asymptomatic hindi ka so adal kora sa sayidal tial musafel me so yisabal mo ulang mo rin yaklol pre-del araktar al sila water hospital.
So in other words, no visiting authorized.
Why say?
As of today, no visiting to hospital. So all of those people planning to go to visit relatives at the hospital, that has been stopped, right?
Why say? So no visiting hours. Hindi gimadangel wasay adadal may radira close pe a supply sa klalo lola para adara baluol may pag agi say gidel temel oding lal 6 elol maklon mo with the clorac say so 6 p.m. to 7 p.m. every evening ngaringar adal mo station that tel madala hospital tel elabi el mo omlay ay gidel udurok len mo so isbra al sel hospital. So please, when you come, make sure it was labeled. Look lang klela. Arum number award the hospital. And then say that mangudla esel bole with the clock mal masimbre. And then it's a mile mong deliver sila other rare mo deliver al sila. E mo subeseng mal di mal makasayar other rare man.
Okay.
Ya al sabihin mo mga la time the say gida ko sabihin al time the set aside ringil mo o malay gidel klalo mo lablo mastria ata nga sil hospital.
I got a question. Is it possible that you change your policy to require everyone that step out of the door or of your house, you must wear a mask? I think if we mask everyone, that also will minimize the spread of these COVID-19. Is it possible that you change your policy to make us required to wear masks when we go outside or go to a restaurant or go to a store? Any public places you go, you must wear masks. Can you change your policy to reflect that?
Kung sa tulig ang nanasuwa sa MHHS directive, alwaseng require masking ra everywhere, every public area over niya, ang ginil nga mask. Even pag kumangkurangan nga on di blablim ra outside lablim kung 20 or more engiri low mask dire.
I see.
So plato of the say del best directive ra susel wasay na mo require mask mong other ko imla mo giri low mask physical distancing.
I see. Government adi malmol sponsor ay gagid el program al open functions elngia ngoy kitriar tokla del moklidib ra imol basyo waya tele 680 night market direct ngaria ada do meset tire to tra otrulid dia halo mask mung direct dia hal help mung government aba should do something not to sponsor ay gagid activities and more require ra ada mo kayo ge de kayo ta Monggo da stove solai telgibel smisi al-ud mergo mortirak lagi gidel lud ma bong al-ud tagi del draft sola kum da song la direct maran merio radel mo positive lang arada patik careless
why saying mal why say tuli mal gira del al make sure en gadol tirak lagi gidel la gidel bladru lamang akunda sa minister kama martial president leadership meeting al afternoon ang dilulwase kaya awngil mo mong last para wait say gidel on div lalo kora ngaringil batokal adlen kira na mo gida del malas la omu ala say gidang self directive sa wala effective ra kasuse ang gira del mga sa del maluba ka toro bay kay gidel kora batokal al maklo al mass gatherings el clote al laborate to you la sulta smell no wala raktal moratara.
Why say all we ask the public, all we ask is practice what you preach. You don't come out to the public and say you're required to wear mask, and yet high officials of this government are out there on the inauguration of Peliliu, Ngarard, and elsewhere, Koror, without mask, and we see them on television. So us public, we do this, what they call a monkey see, monkey do. We see you doing it, so we said, maybe they're not serious. So let's all be serious and do these things right in order to minimize the spread of COVID-19. Remind each other, the high officials government, so do the same. Ata. What do? Oh, don't mommy.
Yes, exactly. So, I give you a vessel update etulig ang bay sa edal nga igal mul masa ang karupak malkora mo nga sual mungi nga karimel mo rin sa emloger and then open al mora.
Okay, so it's okay now. I know there's some people in that told me this afternoon they would like to call in and ask questions directly to either Commander Hancock or Commander Prostrom.
Yes.
So if he doesn't mind for us to answer some of the questions, can we do that?
Yes,
okay.
Thank you, sir. Yes, no problem. This is Commander Brostrom here.
Okay. Good evening, sir.
Good evening.
And welcome.
Yeah, so maybe if there's anything specific you want to address, go ahead, and then we'll take calls.
Okay.
Sure. Thank you. First of all, Commander Richard Brostrom from CDC. Here with Commander Thane Hancock and actually two other Public Health Service co-commanders, Kazu Okamura and Nick Munoz, and the four of us, the same team that responded to the outbreak when it first occurred in Saipan.
Okay.
And then we arrived here on Thursday night, Friday morning, to respond. To assist, work side by side with the EOC here and with the team to get ready for Omicron.
Okay.
We've hit the ground running and wasted no time and have had several meetings with, of course, the EOC and the team here, the minister, as well as with the president and cabinet members today with the leaders, very impressive and imposing group, just to help to share where the outbreak is at this point and where it might go. What is the level of readiness for Palau, for Palau's community in particular, the hospital, as well as public health and it's very clear, of course, that Palau is ready.
Okay, Commander Brostrom, I got a caller. Can you take the call?
Sure.
Okay. Welcome, caller. Kabong.
Yes, good evening, Commander. My question is, I've been following the statistics of Palau's COVID, and I have just like a question about the probable case. How can a person become a probable case, and is that a positive or a negative, and what makes it a probable case?
Okay. Did you get that question?
I did, I'm going to ask Ritter to see if she can take this one, because probable cases are defined differently in different jurisdictions, and in the beginning of a pandemic, we separate out those that are probable over those that are confirmed. Usually by the middle of an outbreak, we call most cases confirmed in real cases. But go ahead, explain the difference for your reporting.
So for the purposes of this recent probable case, we got an antigen for the first time that we tested. There was it came out antigen positive. We put it through PCR, a gene expert. The first run was a negative. We got another swab. We put it in. The CT values came out. The E gene was 0. The CT value for the N gene was 43.3. After consultation with Commander Hancock, we decided to rule it a probable case and then isolate that individual for 3 days. retest on day 3. When we tested on day 3, the antigen test was negative. The PCR test was negative. So we ran the test again the next day, and we also got the same results, another antigen negative and another PCR negative, gene expert. So we ruled it a negative and then false positive case, and that's how we resolved the problem case.
Unconfirmed. It was unconfirmed case.
Okay.
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 It makes sense.
Makes sense, right?
Palau has done very well to get several different testing capacities here. There's 3 or 4 ways to diagnose COVID-19 in Palau, and the first test was positive on this one, but the second test, which takes longer to run, it sounds like it was negative. So then you have to manage these patients when the tests don't agree. Most of the time, they agree.
Okay. So, caller, you satisfied with that answer?
Yes, very understandable now.
Okay.
Thank you.
All right, thank you. Bye-bye. Okay, let's continue on.
Yes. You can continue. You need any,
Oh, okay. Well, in talking with in the EOC here, there's some really key messages that we want to share for the community. Some of these are messages you've been hearing for a year now, but now that the pandemic is here, they're really important. The no hospital visiting is a new policy that was added along with public masking. It is important to avoid, try to avoid big crowds, especially if not masked, especially if indoors. Better to be outdoors and with a small group and a mask on. You're pretty safe that way, outdoors with the mask, with 3 feet of distance. So that works pretty well. And then it's important to not to go to work if you're sick, or not to send your child to school at this point. I know school is canceled, but really important if you have a scratchy throat, or your nose is running, or you have a mild cough, or even if it's a little bit of fever, it's best to stay home, of course. You may not even need a test. It's pretty sure it's probably Omicron, and it's probably COVID. Not everyone has to have a positive test, but it is important that you stay home for at least 5 days till you feel better. At least a whole day after you've had a fever, and not to enter the workspace or be in a public area where you might be able to spread it.
I see.
Finally, I think it's really important that it's not too late to get your booster. So what has happened is Palau is so good with their vaccines that many people were vaccinated in March or April.
Right.
But unfortunately, the immunity has slowly gone down in this time. We knew that was a possibility, and sure enough, a little bit less protected as time goes on. And then the Omicron also affects your vaccine's effectiveness. So if you have a booster, you're in good shape, right? Okay. So that even though the Palau has some of the best rates of vaccination in the world, the booster rate still needs to be higher for Omicron. So
okay, Dr. Brostrom, here's the question. I'm a little confused when you say go and get your booster. Now the question is, can you bypass the Moderna and Pfizer and just go directly to get your booster, or you have to have 2 shots of Moderna and 2 shots of Pfizer in order to get your booster? Is that what you are trying to say?
Yes, that's great, and I apologize if that wasn't clear. If you're not vaccinated, go get vaccinated. If you're already vaccinated, you still need that 3rd shot, that booster.
Okay.
But it's not too late to get your 1st or 2nd shot. If you've been waiting for some reason to get your vaccine, boy, don't wait another minute. And Ritter, when is the next booster and adult vaccine clinic going to be?
So sa igil teme la booster vaccination na klubok al Tuesday ra 3 o'clock al mo 6 o'clock ra Palau National Gym.
Okay, me dito ay silwasay direct marara igar good radio station ma television lo ay silwasay ang oingram oingral sil serker o borgira telaklor ma telaklogan svemen mo nga booster gaw maluben third shot gaw era gymnasium international gymnasium. Mo say
Oing may say.
Okay, let's move on.
Sure. I think you know that public health's been doing a great job here. There, and most of the response right now has been public health responsibility. The hospital has been busy with their regular care, giving regular care, and the community has been great about getting their vaccine, but otherwise medically has not been too effective. But now Omicron's here, and the best way to respond to the spreading virus is not just with public health, but the hospital, of course, has to get ready. And believe me, they're getting ready. We had a long meeting with them today. Those doctors are so determined. They've already started making changes. They're getting ready for if there are patients who need their care. And then the community must put some work on their own shoulders to be able to manage cases that don't need to be in the hospital. That is, there's going to be a lot of children and young adults with a cold and fever or flu-like symptoms. Most of them can stay home. Again, many may not even need a test. You can be pretty sure it's Omicron. And some Tylenol, lots of fluids, some rest, the things that you always do when your children are sick, and then hold them back from playing with other kids for at least 5 days. And that's going to make a big difference. That's the community pitching in. Most parents, of course, when their child has a fever and here it's Omicron, you might be tempted just to run straight to the hospital and be seen right away. But that's actually, the hospital is going to be very busy with patients who are quite sick. So it's important if the case is mild, the child is doing okay, to have on hand some Tylenol to make sure the child keeps their hydration and that they're separated from other kids. And they don't necessarily need to seek health care unless, of course, the fever was not controlled or they started to throw up or get very sick. Then, of course, the hospital is ready to manage someone with a more serious sickness.
Okay, I got a question, doctor.
Sure.
It's been 2 years, or almost 2 years now, and our frontliners and also the service providers for this COVID-19 are exhausted. They're really exhausted, I really feel sorry for them, but they never give up and keep on working and get complaints from the public everywhere you go. They're criticizing them. They need help. Can you do the same thing you did before, send some of your people down here to help our health workers, please?
Well, first of all, I want to say I couldn't agree with you more. There's amazing heroes here in public health and at the hospital. People are tired. They're just exhausted, and not only have they sacrificed, but their families have sacrificed so much time.
Right.
They work here on Saturday and Sunday.
Right.
The team is here tonight, for example, just like they are most nights.
Right.
A lot of heroes here, sir, in Palau.
Thank you.
That being said, they are sort of, ready. This is sort of what they were been preparing for. All the work to prepare for is here. It's time, and they know it's time. Public health knows it's time. So does the hospital. In terms of getting support, that did work really well when we had the federal teams here with us. I think it's the last time that we talked.
Right.
Back in March, and we were able to provide some respite for for all the vaccinators there for a short time.
Mhm.
But requests have gone out, and channels are being worked. All channels are being worked to try to get some additional assistance, both for outpatient and for possibly doing some community testing, as well as in the hospital to help in the ICU and where some of the more critical cases. Again, right now, no cases in the hospital, but we expect that might change fairly soon.
Okay, thank you.
Sure.
Okay, let's continue on.
Okay, there's these changes we talked about for patients. So in the past, when you got COVID, public health remanded you to a government facility, and of course, with as you heard so many patients today, we expect that will double pretty soon. Usually every 4 days or so, 3 or 4 days, or sooner even. That number can go up. There would soon not be enough hotel rooms, I think, in all of Palau, and so every community in the country has moved to a different chapter, where the community begins to learn about COVID, when they need to seek help, when they can stay home, and the isolation and the quarantine are done by the community and not necessarily by the government. And so we're at that point now. But the community needs to know what to do, of course. And public health here has created a fantastic form. It's adapted for anyone who has COVID. If anyone is diagnosed with COVID, these forms are given to the family, how to isolate a patient at home, how to quarantine, what to do for each individual to keep them comfortable. I can tell you that for patients who are in isolation, it's important that they stay in their homes. These are the people that have been diagnosed with COVID-19, so it's important that they should stay in their homes. They, of all people, they must really wear their masks at all times when they're at home. That's not always comfortable to wear your mask. We understand that, and we're trying to get away from the cloth mask. We're trying to use surgical masks, and so public health has already stepped up and created a fantastic home packet that has the instructions in it. It has surgical masks. It's got Tylenol in it. It's got hand sanitizer in it. So it's very well designed for a family that has someone ill at home.
I see. Okay.
Those folks that are in isolation have to monitor themselves for symptoms for runny nose, sore throats, scratchy throats, headaches, and fatigue. Some of the old symptoms you heard about, like loss of taste or loss of smell, little less common with Omicron, and it more seems to be scratchy throat, headache, and fever, and tiredness. And then there's a number here provided if that person starts to feel more sick, because they may come in for another assessment. What's really nice here is that Palau is going to be able to have treatment that is outside the hospital for their COVID-19. So we can talk about that. Most patients, most individuals who get COVID-19, they're going to be fine. They don't need treatment. They need Tylenol. They need to be isolated and at home, and they're going to get better in usually just 2 or 3 days.
I see. Okay.
Some of them are going to be very sick and will need to go to the hospital right away.
Yeah.
And public health will be there to monitor those at the time of diagnosis. We're implementing some changes for that even today.
That's right.
And then there's other patients who can go home. Maybe they're a little older. Maybe they have some diabetes or obesity. And if they have some symptoms of COVID and they have some risk factors for getting sick, then there's actually some medicines they can take that will prevent them from needing the hospital. And most of those medicines are not here now, but they are on the way. Okay. We know they've been ordered and they've been shipped. So over 150 courses of these medicines are coming to Palau, and there'll be more after that. And that's, for people who have COVID and they're uncomfortable, they've got risk factors, and they have some symptoms of disease.
Yeah.
And we're setting up a new clinic for that, and they can come and get their treatment in that clinic, and then after that treatment, they can go back home, which is marvelous for.
So maybe you can explain, we've said that we have region code, and the reason why we have an ample supply, like over 300, but
yeah.
Maybe you can explain why.
So one of those medicines is called Regenco. Works fantastic. Great medicine. We've given a lot of it in Saipan. We've given a lot of it in Guam, but it doesn't work for Omicron. It works for Delta. Because Omicron has shifted and changed its spike protein, we say, that medicine doesn't work anymore. Which is why the medicine that you need isn't here yet, because it's new, but it's made, it's been allocated for Palau, and it's on its way to Palau. And so it's sort of a Regenco, but it's tuned and works better for Omicron. Quite effective, 70 or 80% protective of having to be in the hospital. In addition, people might know, and they may have read, the FDA recently approved some new pills to take. And this is a 3-day course of medication to take, and 4-day, I believe. And these medications are also arriving on island, and we're setting up the clinic to be able to hand those out to people. Again, this is not for everybody. If you're not having these symptoms, this medicine's not for you. You don't need it. If you don't have any risk factors, you also don't need this medicine. We're saving this one for people who have maybe over the age of 40, maybe diabetes and obesity, other health risk factors. There's a list of those. And then symptoms of COVID, so we're worried that this person might have to go to the hospital soon. And so if we give them this medicine, they can go back home, which is wonderful. Once they get to the hospital, there is treatment that's typically needed, and that treatment is already here in Palau and in adequate supply. We're trying to get additional doses of one of the drugs called remdesivir, but oxygen's one of those medicines, and you have plenty of oxygen. Dexamethasone is the other one, and I know that your team has done a great job of making sure there's lots of that. So I think, again, Palau's ready. They're as ready as they can be, more ready than most communities when COVID comes. And that's because of all the great preparation work that's been done in public health over those last couple of years.
Okay, so can we say that preventive measures is the key to manage or reduce the spread of COVID-19 virus? Can we say that?
Oh, yes, of course. The preventive measures are needed to protect the hospital, to reduce the number of patients who get COVID, who need to come to the hospital. Especially for those who might be high risk, could really save a life by wearing your mask and making sure that you are keeping a distance. Those preventive measures about not going to work or joining groups if you feel sick. To be honest with yourself, and even though it looks like fun, everyone's having a good time. If you're feeling ill, you need to stay home for 5 days.
Okay.
And let this pass. You're doing the whole community a great service when you can do that.
Okay. Okay, let's continue on. I hear somebody coughing. Check her out. Maybe.
Yeah, tulik. Jaka sa wear a mask. Kamama di wear a give you mask ilang amang. Kan ko mo magalmol mo kala tong makararay kal mask ma isken mo doklo. Pwede. Elang ang require that role other may hospital. Of course, ang gina dalong mask and specifically sa over hospital imla mo gira da low mask mo.
Hindi agi mesa kami ngog te mama te agi mo tangay.
Tuloy ka mahali ako tunga ol ko yung ulan mo masyadol may ngorangan nga message ringin.
Okay. Anyway, our telephone number here, callback number is 488-4848. So if you have any questions to Dr. Rostrom or any members of the EOC, please call 488-4848. Okay? Now back to you, Riter.
Kamal masaulit tulik. Hindi sa mamalamaklat kay gel bladung ka ruba kalobangget.
Okay.
Mula sa klolurio ramlam katmokla agi mal nga kadamla kay nga sera dalong level law ay sera rogul adult maseng ngarangay gel sab edel mga tmokle kadol nga Christian Ract may akmal klolurio ral kit mokler adara ministry ra helda prepare tel hospital regit mang sa el sugu mang mornia ser tegi del COVID-19 ing sabir el mail me malaya yel lugurul el mortrigel el hito ya raktit ra COVID-19 so waitel lulugorin yung karuba kak masay ay ategi del Omicron matel COVID beto karigida adi mild symptoms rigid el sab edalo malimar watay lenor malima clodral engol nga sa rigid rablit awul magi mlamo olingitra adrablul sel mail positive malubeng wa nga symptoms tir gimal mga leetik mase please mga sugmame bora kablimiw moru lay gay del teleta el niya ol nga sergumiw mo ko mongil da kam pridital raktal mora arbotokal at lesel bol botokal atals mer eng morngi trigel me botokal mer hospital eng ilmos mer nurse maluba resources amok ngemet masel labor ni trigel maralo spel met mul mer hospital eng waya plabol compromise ta system regit awul magimal lolingi te tuli gal morar adak mase plisable moklorngo de takay nga sera dolong let mal suguma adra public health ulingi terkak mase kautel ka gimla matigar kawal positive ra covid ma yagida sab emel remul rablim yagida gen mal girem momrul mal ubeng eng tamatigar kak mase kamlok medra adel covid mangirem el quarantine rablim yagida gen mal girem el loltirakle tuli ka mal sugo mandiungile haledik ko over yagida maldi makasayel masengrang ayel el girem el mru lesel obom ray
Selba, suma capacity be morme e bes kama 1 2 3 rogula se gotre magara o de apa
amai sei so sel nia mal clo tu telela mal gire mal dinga rablim mal da kal se emel motob de gire mal dio maskara vekal time
ya mem statel wase al suguma hospital am tigana hal positive kaul adel mem laer nga hospital make sure ko ba masker kau mga kawera bok masaram la aklo ya masker nga hal positive bok masaram la do bangel ngal adel mem laer kau en gire teru lo mask sen wase
mal maranye tuli kamral masaul mal ube kamler hospital ko koram lo mal asirgal kora mogol umur gole makaw takyal el hospital ni del strigan rogul adal ngar el sel mlay mal giri lo mas ke gida kora telgi belonga tamador git ngungi layol te circulator al sel
mangal magigad umur gole maluben kora mogol umur gole la mal giri lo mas kemen dia spray det
mangel adalo makalir ni teru maltede malteo ngal ngaramlay agiri lo mas ko rogui okay ati taltay mada kal si elada kalomas ka toloy malubeng gelge karel ngal kal dakal sab el dingil gut mal mere ramas karingi ero kulat agiri lo maska so se girel mal mobla katakla
well taken
Oy say mal gira del sel dangar ablay gida bl oil so adel magalo mur so ay gida gel momade el gel bl oil bl gar del dangar ablay magara blit agira del mongul modera dorul ele tianga del forever tianga di yakade bel time sa idul goring gal toktang al masing 5 to 10 days and then ang most of edel guk momrul ay gel dorul so el al time hospital asing 10 days
Marbebira tugol partra khat surigita tugol omla me kayungita ma ale misosia amle me ngumsange agida agire del mosto mo wase
Why say?
Okay.
Ita kata kay buged. So as much as possible, Angel smell guk ngarinya pasyor ngi lami iway beringi.
Okay.
Al suko mangarinya guk bathroom mangya mangirel guk ngarinya bathroom beringi. Dil suko mandia ka jol sis aklar adult masay sel labora bathroom ngirel momre ke ngarinya disinfection mangarang clear bathroom ending mal girel dingara room beringi.
I see.
Adire kal del gimol sis aklar ada kasengungi la blay al open mang ayol tamet mu emotbo betul. So al suko mangar al sela room al air condition engungi al telgi bel open ramador ngi masay yagal yol telnga al sel tel room asabe el top dar al sel daka dilngar al sel.
Okay, ela tiagi da next question. At sugum na mereka 4-5 days nga ham na mo feel better. Angel me certifier nga han wase ak mlamo ungil men sabe ek top da hospital amerabli kan ube nga utangan mo hospital no por test nga.
Tulig ela sel mirada yo ay sestir mula say kamla madang day 5 kamel me test.
Oh, makito.
So malinda ka mo bes sel o motakyal el mel me test mangirir adalo mas ke open amado. Ding lang arnya time riter sel angar mada del time en mode ka way ke gidye. Mara gimo o way srar adik masay mla mode ka test regis and digya the test. Kada di mo madengel masay sel bornya symptoms sergaw el gora ongar ngit ta makarang ya e kalo asme ang kay tang karubal masay kalo asme el tel omicron. Sense edel mulay serite. Why set tulig mang tamalakol waseng 10 days and through sel gira mal isolate sergaw. And man kel smer man gira 10 days el ligat say mal atente ang kadal amo test al sumangarnya test kadal test elang yang tulig ang mlamo tirgale ada surveillance sa umgodong or tirgale namadang almod adu or tira interview identify contacts anding quay tagi del ngal sang sela test mlamo dia kada test ra contacts.
Okay.
Sige al ukol made al self al ngarinya test sige del walong ay maklamsay or tirgale del contacts and sa baril me test. Ma atako ya mor tirgale abel waseng tamorger ra o ngarang me usay del test either the test out wasing ngara quarantine mo sa hidal time test o correct quarantine ringi.
Okay, so mga nya adam lekker o ayablike emergo emle positive mon mo 10 days later mo sel pasyo man open pial blind remain contaminated until when and comes so they say.
So the question, Dr. B, is if he has a tenant and he was a positive and he lived in a unit, and then after 10 days, so how long after that 10th day is it still considered contaminated? Does it need disinfecting?
The unit itself?
The unit, the house, the room.
You know the patient's good.
Yeah, after 10 days.
Yeah, you know the science for that doesn't exist. I don't think anyone has tested that for the bed sheets and for the trash and for those things. So I think we would just recommend the typical common sense approach of washing sheets and regular with water with bleach in it in a regular load. It could even be mixed with other sheets. That's okay, especially after 10 days. There's been no report of virus surviving beyond that point on common household surfaces that we know of. So you should feel free to, for example, there wouldn't have to be a sterilization of the carpets or just a wipe down of the counters and washing the sheets and the normal things that you would do between tenants should suffice.
Okay. Riter ngong balwala mo la sengire the disinfected tialblay sola enyam uspel safe enough for moranek la ulak malwa ki on ay gagi de hotel motel type rental units and there's a possibility that some people come here positive and they leave and they go back to somewhere, but that room that was used by a person that is was a positive remain contaminated until we disinfect that unit, or it takes maybe 2-3 weeks to get rid of it completely.
Yeah, I'm the 24 hours airing out and cleaning. Smell like
Oh, okay.
Smelling, it should be good. Yeah, mangalada kasing ngukte kalgora special sterilization process awom go through ni sel omoru ni rabe time sel gol mere ka tenant tel kirablay e gamol kut makli e wipe down ni e smil kay kalsit sa curtain sa mga rang say dia enough di of course e kal mo cleaner ni the person cleaning should take precautions and wear their gloves, their masks and stuff like that.
Can give it 3-4 days or 5 days and they have building it back to normal?
She is asking, can they leave it 4 to 5 days and kind of feel safe that all the viruses are dead by then?
Yeah.
After the 10 days?
Oh.
After the 10 days, then wait 4 to 5 days just to make sure, or no need?
I think no need.
No need. See, okay, that's good. So we don't have to clean it. It automatically, disinfect itself.
Well, you have to clean it for your next tenant, but please, you don't have to be too paranoid about it. You can go in and clean it.
I'm trying to do away with cleaning, and then you guys said you go and clean it to be safe. Okay, I understand.
Tuloy ko mga hindi kaya kita ko ramal soma lumaktat karar adaling ngarinyar adal ko kamay masengkal sa ang atyo mibay senga quarantine mahimal lolingit rar adal masel suko maka-isolate maluga ka quarantine rablay please edi mga rablay mo taka ngaling maldi 10 days and then ang sabi maluguk mo umibay.
But the general public have to take some sort of responsibility to practice those preventive measures by, for example, I went to a restaurant and couples came in with the wristband, blue and red, I think it was, and then I saw him coming into the door. As I was going into the restaurant, then I saw him and I said, hey, let's get the hell out of here. So we left, So I think what I'm trying to say is that, also us, the regular people, we have to take some kind of preventive measures by avoiding contact or near to these people that wearing the wristband. I think that we should do that also. What do you think? I refuse myself to go into a restaurant where I can sit next to.
Hindi ang patnil yung mga kumbara restaurant da to ara dari ang mesa adalo wristband ra premium.
Nice.
Kamera rin yung giril tirga sa giril mo regel pandemic certified gives in more regel basyo.
But they do it anyway. They do it.
Well, tamang and then kita waset di sumong baser please edil order at take out the tire tibol pick up pakalire lorail la kalabong el care selo mungur mandira kal diungi la sumong komong emestri dira kal diungi lo omkol el mail wase tira adar ngara ROM nga stel basyon mal meserda. They shouldn't be in a very crowded area.
Okay. Edol, I got a question just came in. It says, please ask how can I distance with my family of 5 in a 2-bedroom home? What is the best way to keep my distance away from them?
Well, if no one is sick, then there's no need to distance.
Okay.
Okay, so that's the first thing. We don't want people to distance from their family.
Okay.
Right now.
Okay.
But if someone gets sick, then it's best to sort of assign one of the 2 bedrooms for that sick person.
Mm-hmm.
Other people may be sleeping on the couch or sleeping together in the other room.
Yeah.
And the public health does have some recommendations for how to do that. I think you went over those already.
Okay.
How to isolate at home, it does mean some inconvenience. But one of the things that's really important to remember about Omicron, it's so infectious.
Okay.
It's so hard to stop.
All right.
But it does go away compared to Delta pretty quickly. So we're expecting a lot more cases in Palau.
Okay.
But we also expect that it could last only maybe a couple of months. So it might go on longer than that. It could even be shorter than that. But in general, Omicron is a variant that passes pretty quickly through the community. So infectious, it's already, as we've seen the numbers here at Public Health, which started at 8 or 10 and now at 20 and then up to 50, and I think they're going to continue to climb higher yet. I don't think we're anywhere near the peak.
Okay. Here's another question, which I think kind of technical question, but go ahead and ask it. Ask the question, and if you can answer it, fine, but if not, that's okay. The question is, if I have to isolate for 10 days, do I need to apply for sick leave from work? I don't know. Written civil apply siguro na kapalimentary lang kurang ada symptoms sergao at 10 days mga isolation and so will put in for sick leave sa kita question.
So sick leave ka sum ka maal identified positive and then actually more sick leave.
Hindi ka automatically discuss sick leave. You apply for it. Apply for it. They don't automatically give you sick leave. You have to apply for it.
Oh, mo saying sa emal nga pabil nga tokta maskal was ka nga sick leave 10 days. One day.
Okay. And if I don't have sick leave time, then it'll be charged to me in advance or something like that.
Sila kita ko kaksal madangali at tuli ka.
Okay.
Ako kikira kabalment ako tingala sa kabalmental kung ang ka sick leave ka sa ila maledra ka request sa advance sick leave ka.
Okay. That's the answer.
Sa din kaksal madangali ko private ay ko kira lay ko bali mo.
Oo.
Ay ako kurangan niya policy hindi ka balment ako tangali process ring.
Okay.
Hindi sir ako tulule la pandemic ya kadam le mitrar oligi tertil mase bakay nga sir role la ungil el sick leave policy mar ada la kalbolo mar tertil belo bior el smer el YC so ay gigidal ko private sector ako tuligi tak mase please mo lang sewe helper ada malakal talmo obul tuli ka before ada continuing please haledik ko over ay gal gora di mal di makasay lemlen kal ruba ka dim lakal sal insera question rengel ngara 2 bedroom so you know ay gimal malgor ata sel me ay masay ay gel rogul dur rule so moda kal si it makalomur ela ka mamal adal ngara EOC ata ka gimda kalomur sel gimo meeting amas ka roguy sel gimo mura ay gora oprid so moda gim ka story ay gimo murle say kita pe la virus salimul so moda ka way gay das makalome sa TV so ang karuba kamlo mention ok masel su man 2 bedroom maybe si al assigner say kita 1 room el mobility ars mer so say kita le even at maskit advice at masel su ko manghal maagiri lu ngarawan el space yawan na ngarapital side ra room yawan na ngarapital side ra room so gay kita gel lulukok masay kada mo ko ra mata arbasude mo inconvenient ending mal gira dal kay nga sira dalong le dara tulungal ka matel tal balwa de tuli ka mang le gimo al nga sira bulul mo skura babel sa baam ding mo nga song cycle facilities mang gira dal mo lingitrar adal isolate malubet ta quarantine rabliri so ang mal say gida mal important as much as possible as mera nga rabita ra kung space rablay ma adaro ko yang rabita so gida kadokora mo o ora awara manding ang kay kita karubak pasen tiang adi mere enda kalsal gupmal mo makate kat do arme engi ay new.
Okay, thank you kamal la detail ngi kamla smoothing man mora detail magi la mo understand sulang edol okay kapon
ngadi mlegay kita tulig elang ya kadam dingal wasang ari sa idal hotline al 4880555 se seldo ko niya local time ra total mo ra 3 matal clock sa 11 o'clock elang ya kimla sir apra ko hotline ra medical hotline ko sumara da ko ra kasmer ngariya ko ra questionnaire tira lu bitirga gidel ko ra amlamdang asmere ko ra ngariya kariral mo ra atokta malubeng nur say gidel dengwa bo mo sabenil ko larini wal kwadirga kim sa amal announce ni elang tadir ka maruras schedule tiras toktangal mo enseringi usay gidya aklugo ke self al marulas schedule waseng tuatanga mo enseradeng wa and then I got the announcement mo rablu.
Okay, beto mo siya question Ali caller.
Ay balngil ko siya tulik. Balul ko siya lawat kilala na iosip kilala toktak.
Ay.
Ilak pro sila ilal istiday kawadet ta luwas gelibo. Kuasa kapa baru sel kipara. Ayah jiwa babura jiwa free baru aja kipara.
Wajib.
Elak cair. Elak semua harus. Abi obat sahpe.
said 3 feet, 6 feet.
Right.
Distancing.
Right.
travel health.
Ma veo, kom dia masker terung yang ia take care kau. Kamu nge edwal mo kami sesi.
Daka malamungil smoothie tulik. Daka ngot esekat mo.
Kom dia masker, baby that time edwal ma. Aigal, todos fila kami sensor git. Asub dia abdul sa gesper, dulu ya semlia masker kau, nur serawer memurut terang. Kalau ia masker kau, kom dia lo masker yang take care kau. Betul tu. Okay, tengo aquí que tengo la colia tal sigang dir ngania somil dormon nga atama temi we dol meset somi
tuli hale tegi da gora report tal digam ne soy som hale ba u ay se kutta bedimal
lemay
el alfil se komnege la seng dari se gidele open padra omrusra padra kril mor babra fighter لسه قال سيد الستيغا كده ندير ملو بريق المروس ملو 200 دوري 5 ار مول نالغ ال 5 to 11 ار كرير مروس الغوت الوروس so unfortunately I get rogu ra 5 to 11 years old and do lab mlaringa gigi del darian le dori 1 mlaringa 200 del may mang la modia ya kada expect الموت 200 لنقول سيد يا تلغاي بس كذا ألغاي بس كذا أدراسي دي سيس هذا الأوردر فاكسين.
أوكي.
أجي الموت المو بليس را أوردر يبغى بلاسم السبعة من مسام الموق فلور سي.
أوكي.
نقول قرام لميو ده جاي كذا لو بروس را نقول ما هي قرام ل ديملاجي موليتا راكلول اللي ديسل أوروس اللي تجي قد ناو بيل واسيت بتوع أرنغرسي أرنغر نرسي the age group 5 to 11 لو سبير أوروس من أجي مملاس من الأوردر أبتوع مصب إلمي بتوع من ديجو تبدير الآن الواسع سل أمروس را Wednesday را 5 را 3 مو 6 أدي مو أمروس المورا 12 را كريل مورباب.
Okay.
إنت بتسأل 12 را كريل مورباب نسبة لا فرصة نسأل بلول هذا الميوم فرصة سرني.
I see.
سيجي the Wednesday. يا أمروس أخلوه or سيجي Puka Moderna booster 3 o'clock almost 6 o'clock.
I see.
Ito lang. Dr. B, did you want to add something?
I have a question for Dr. Brostrom.
Well, first, I just wanted to add to the vaccine discussion, and maybe you mentioned this. I apologize. And that is just a recommendation again to the listeners. One of the most important things you can do to protect yourself at this point, if you haven't gotten a booster, to get that third shot. So I know that Public Health will be at the pod tomorrow at 3 o'clock till 6 o'clock just for boosters, and the same on Thursday. And if things are busy and we need to open up some more, then we're going to add additional booster clinics. There are several thousand people, adults, who did a great job to get their vaccine, but they still need their booster. Unfortunately. So if you got your shots done and it was before September, before 5 months ago, then this is a great chance to really protect yourself. When you get that booster, it really protects you from the Omicron. So recommendation again for adults, actually anyone over 12.
So we're not doing boosters for Pfizer yet. We're just doing boosters for Moderna. And it's anyone who got their second dose February, March, April, May, and June. So starting tomorrow at 3 o'clock to 6 o'clock, anybody can come in for their boosters.
There you go. Thank you for getting the rest of that correct.
And then also Klugu on Tuesday, mostart الترجل نورس homebound مostart المروس booster dose المرترجل homebound من دي قرا دي وتبديه وأيس المرترجل homebound الواسي ترجل نورس رقمي وملا start لهم غضون اللي يقوم schedule رقمي والمو يقوم روس رقمي ومن مفتقال تغودان the list أو قرا start أخذي لا شكله كت schedule بالمروس R8 homebound.
Okay.
hindi mo lang po nga rite. Tuli kang nganya bloil alcohol may bloil da ka enser ka ma'am. Loger ma say ngoy ngara ngagi ungil al kim kol malubay gimo mesa toktang kol say arangal ka kalsak la ngugil akpor ER. So elang beto katro ya kadamo malukora adak masyo ko morbay sugo marangal giwang makayal dama kami makayal de kora makayakara yung sabihin malatay lenore mali marakloral di nga get tuli ka blol dio paranoid blol dia kutek masemo makarang mo sel mal momring laptru ka kol alube ngoy ngaral timing namo gire ka lom ko tong toktang malubak mo mesa toktang so mo askara Dr. Brashroom to explain when if somebody is isolating or quarantining at home and has symptoms, when would be the time to call for medical advice or to seek medical help?
Okay.
Yeah, sure. Thanks for the question. I think it's really important now too because people with COVID are going to be, most of them are going to be managed at home with the kits that you're giving, with Tylenol, with plenty of fluids, and they're going to be fine after just a couple of days. But some people will need to be reevaluated by a doctor, and that might just be because of a fever that's not going down, changes in a person's ability to think or to make sense to you if you're worried about an elderly person who seems confused. But usually the symptom that brings people to the hospital has to do with their lungs, because COVID affects the lungs. And that would be shortness of breath. So a person who's breathing rapidly would be someone where you want to, if you find they're breathing fast, they're going to need an assessment by a clinician, and they'll do a careful examination and determine whether that person needs to come to the hospital. Or there are other ways to look at the breathing. For some people, they're just going to all of a sudden not be able to go up the stairs. So they'll feel short of breath trying to go upstairs or speak a full sentence without having to pause and catch their air. These are the symptoms of someone who's pulmonary-wise, lung-wise, starting to have trouble. And there won't be a lot of these patients, but these are the ones that need our medications. Doctors are ready for this, and this is when you'd want to make sure you call that phone number.
Right. So, in other words, if someone is coughing and never stop, or have a headache, or cannot talk anymore, and, major, there's some major things that we have to look at the patient in order for us to decide it's time to go and see the doctor. Actually, mo confused tilang edol mo lasing ngoy nga time sel to consider ngi kita dia ka tok tam dia to ngi ngong wang sel bal blabol wang rang ang gas me re kita pal master mo sa tok tam.
The cough, the runny nose, the fever that gets better with Tylenol, it's probably okay to stay home there. But if the person's having a hard time breathing, then of course it's time to call that number. Some may need to come to the respiratory clinic, the special clinic we're going to set up for the community, or others will go to the hospital and be evaluated at the hospital.
All right. Okay.
Oy mang kami milsadak masel sugumang telguklel dele makukmal di bekal polio kukmal dokora di kadi makayal kokora moda ka moda ngalarang ko mo confused ka moda ngalarang mo ka musamal basyal alube ka mo kade batlim yeyi da yel kora mlamo gire mel kolra ER ko ogera toktang sudak mase oy adon morgo moral met mum mlamo gire moral met sakaw to yeyi da yel
dia mongil ava ma moy tatrile mo hospital
ay se tulik se bebe la kaduk koramal maklorong udamang bukta mong sal mangilel mo hitoy.
Okay, continue on. Dirganian but soniro to.
Hindi ang kora di kay kita tulik ang mga paingal nga katiraras.
O tihala ng utya. Ali koler kabo.
Tulik maluwi ka bisngel korkaw.
Oy.
Aw mga aga
DOC.
IOC ma CDC.
Oy.
me kung tela ro kung business no nga sulit ang Taiwan ang CDC American. Til al toktangan sen destin men sir gida ave now. A minister maral.
Say.
Mahal nga na akustigal lomrure al time nga niya sir. Ang ginagawa di mga sulit lulu gire mdiyan mulu la sir mortir.
Okay.
Pero mo maulili kung man sulang ro ko na ika.
Okay. Yeah, you guys really we feel for you. We know that you're sick and exhausted, but nothing we can do but to say, please continue on providing service for all of us. Okay, now back to you, Editor.
Dr. B, did you have any final words before we close?
Well, I just wanted to assure your listeners that that additional supplies are on the way, and that the partners in the region are aware that right now Palau is having their first ever COVID vaccine surge, and so we see test kits being shipped to support the surge from YAP, test kits from American Samoa, equipment from Guam and from CNMI. PIHOA has reached out, our neighbor across the region, our partners that are running the healthcare systems are also working hard to get Palau what they need to manage the situation. And in addition, the federal agencies like CDC and ASPR, we're hoping to also be able to get some assistance from other federal agencies, possibly even DOD. And in addition to that, there's international assistance coming. I know that Taiwan has promised some testing and maybe bringing some specialists over. So I think Palau by itself is very prepared, but I also think you're going to get good help because we do know that when Guam had their outbreak, Palau stepped up. Palau was able to send them testing. So now it's Palau's turn. So you're not alone. The region is doing their best to support this effort also.
Dr. Brewster, I'm sorry, but I have a last question just came in, and it's an important question for you to answer. The question is, some of us Palauans are drinking water from water catchment tank. They say we can get this disease from air and all. Is it possible that when you drink water from water tank, getting water from the roof, is it possible to get COVID-19 through that?
Thanks for the questions. It's really important when someone has a question like this to ask someone from the health department, or maybe the answer could be with a reputable online a source like CDC or WHO, and it's important to ask around because there's so much misinformation and so many rumors, especially for this disease. And so as the outbreak occurs here in Palau, we're going to hear more and more misinformation and rumors. And so I think public health knows that's part of their job, and that we have an information officer here. Part of the job is to get the right information from the right source because that's what the Palau community deserves.
Right.
As far as drinking catchment rainwater, it's fine. There's no reason that you would get COVID from catchment rainwater.
Okay.
I think COVID would certainly be a problem if you were dehydrated. So it's important to drink lots of liquid. It might be it might be a source if you're sharing a cup of water with someone else who has COVID. That could be a source, although not usually from touch. It's almost always from sharing the air. So no problem with the drinking water, no problem at all.
Okay, Dr. Rostrom, can you advise us that it is the best policy to listen to CDC and WHO and EOC here in Palau and disregard what's on social media, because social media nowadays are really putting out a lot of fake news and confuse us and create more problems. Can you say that?
Yeah, Dr. Facebook is a bad doctor. Palau has some really good doctors.
Okay.
And some of what you're reading, it's very clever, and some of it's even kind of humorous.
Yeah.
But it can be very dangerous.
Exactly.
And when we try to pass it off as real information, then it can be quite hurtful too. So it's really important. The ministry here has put out some great stuff that's accurate, and of course the WHO and CDC, we're doing our best to keep up with this outbreak, and so everyone gets the information they deserve.
Okay. Thank you so much, Dr. Brustrom, and Irite, thank you, and Edon, thank you, doing a good job, and may God bless you all. Until next time, this is Alfonso Diaz. Say bye-bye for now.
Bye.
Okay, bye-bye.
Bye.
Laragi Darage kalye balu Alba belak malumi Belak malklabo Baydorai Bome sa balwa